Hi, I'm Dr. Braddock. I'm excited that you're here. Since 2005, we've been serving families just like yours an incredible chiropractic experience. You're going to find that our approach is different than some chiropractic offices, but it's that approach that's made us one of the top offices in Texas. For you to be able to fully understand what it is that we're going to be looking at and how chiropractic may be able to help, it's very important that we take a moment and understand the nervous system. Now, as chiropractors, a lot of times people think of chiropractic as bone doctors, but in all actuality, chiropractors are nervous system doctors, and we pay careful attention to the nervous system because it's the master system of the body. Let me explain what I mean when I say nervous system. So your nervous system is composed of your brain, the spinal cord, and the exiting nerves. Now the spinal cord and the nerves are protected by your vertebral column, and in between each backbone there's a hole, and those are where the nerves exit off the spinal cord and they go to innervate or supply every cell, organ, and tissue of the body. Now, the problem lies whenever two or more of those vertebrae misalign, compromising nerve flow. We call this a subluxation. Research at the University of Colorado found that it takes just the weight of a dime to reduce nerve flow by up to 60%. Now, while these spinal misalignments can often be painful or uncomfortable, they may even be the cause of the symptoms that brought you here today. It is possible for subluxations to exist with no pain at all. When a subluxation is left untreated for a long enough period of time, the area will begin to degenerate and develop things like arthritis, disc problems, and bone spurs. It's important for us to understand where this nerve supply goes. Well, the nerves that exit your neck go to innervate things like your immune system, pituitary gland, sinuses, face, inner and middle ear, eyes, tonsils, teeth, the outer ear, diaphragm, the neck muscles, traps, shoulders, all the way down to the hands and the fingers, lungs, gallbladder, liver, stomach, pancreas, spleen, the adrenal glands, kidneys, colon, appendix, diaphragm, bladder, sex organs, and so much more. Now that we know where those nerves go, what does that mean? Well, when a subluxation is left untreated in an area for long enough, the body will begin to develop symptoms. Now, those symptoms can vary greatly depending on where that exiting nerve travels. So let's start in the cervical spine and work our way down. Cervical misalignments can lead to things like headaches, migraines, lowered immune system, sinus, hay fever, sleep pattern problems, eczema, stiff neck, tonsillitis, chronic cough, croup, asthma, heart conditions, bronchitis, influenza, gallbladder problems, liver condition, high blood pressure, indigestion, heartburn, gastritis, lowered immunity, allergies, kidney troubles, chronic tiredness, constipation, menstrual problems, bedwetting, sciatica, back pain. Lastly, what a lot of patients don't understand about chiropractic is it's much like medicine in regards that different doctors do different things. Think about if you went to a neurologist and a urologist. They're both practice medicine, right? But they do two entirely different things. The same thing's true for chiropractic. You could visit 5 different chiropractors and get treated vastly different, depending on their focus or specialty. At Braddock Chiropractic, our focus is structure. We know that normal structure gives you normal function. Bad structure gives you bad function. If you had a bent axle on your car, you're going to have worn out tires. We don't want to be your tire guys. We don't want to be constantly patching or selling you new tires. We want to address the axle, the cause of the issue, so everything works the way it's supposed to. After your exam and consultation, we're going to take digital weight-bearing x-rays. It's important that we have the opportunity to fully assess your spinal structure. It's going to allow us to determine what exactly the issue is, if it's a chiropractic problem, and if we can help. The thing that patients enjoy most about our office is if we can help, we'll tell you. And if we can't, we're going to tell you that too. We're going to make the appropriate referral. To see is to know, and to not see is to guess, and we simply don't guess when it comes to patient care. Lastly, after we've done a detailed line analysis of your x-rays, we're going to schedule a time to sit down with you and go over those x-rays top to bottom. We always encourage you to bring a loved one or a spouse along with you for this appointment because it's a very eye-opening and engaging appointment where you're going to have the opportunity to objectively see what's going on with you from the inside out, and whether that's causing the symptoms that are holding you back, and what getting better actually looks like. I look forward to taking great care of you. I'm very excited that you're here. If you'll hang tight, myself or one of our other doctors will be with you shortly.